At Care Hospitals, we understand that for our caregivers to care for others, first we must care for them, while our selfless warriors keep the fight raging against COVID. We are here to ensure they have the support they need, starting with the most prominent members of our staff, our nurses. Nurses are the backbone of any hospital, and at Care Hospitals, we pay special attention to their well-being. The pandemic has placed a huge demand on all the medical staff, and we have been focused on taking care of our caregivers first.
During this pandemic, we are doing extra duties than usual duties, as well as increasing of patients. We have to take care of more patients. Because of this, we are getting more workload and we are getting more stressed, as well as we have to wear like personal protective equipments like PP kits, face mask, gown, mask, everything. So because of this, we are struggling a lot. We are getting so hot. Even AC is on also, we are getting so hot. As well as we are not able to maintain a close contact with our family members. And these care hospitals are providing a lot of facilities like transport facilities, nutritional facilities, hostels. The hostels are so neat and clean. We are safe in that hostel, and they are providing extra COVID allowances and insurance.
Of course, we care for all our employees equally. During the pandemic, we were proactive in ensuring our employees' physical and mental well-being to make sure that they don't burn out. Our extensive COVID care program was put in place to provide a safety net for our COVID warriors on the front line of this battle. We are prepared for any eventuality and ensure our employees are cared for safely and effectively.
I got sick because of COVID. Then I was completely taken care and monitored by the team of doctors and even the hospital management. The team from Dr. Rahul, Dr. Parpeen, Dr. Abdul, all of them were very concerned about my health, and I was really taken care of during my stay in the hospital. I really feel I was a part of this family, so that all the members of the hospital were like my family members who were really concerned about my health. So I feel very much secured to stay in the hospital and work, and after my recovery I was with reborn enthusiasm and energy. I worked in the hospital and I was taking care of my patients, including who are suffering from COVID disease. I was able to take care because of the security and support I got from the hospital.
At Care Hospitals, we instated benefits for our frontline workers right at the start of the pandemic. All frontline workers are given maximum safety, and in the event that they fall ill, we are there to care for them. All these measures have been put in place with the health and safety of our employees as our highest priority. We care not only for their physical health, but their mental health as well, to prevent stress, burnout, exhaustion, and other ill effects due to the pandemic. We partnered with Silver Oak Health to launch our Employee Wellbeing and Assistance Program, EWAP.
During this pandemic crisis we had faced last year and this year, and being a staff of Cath Lab, our first priority is to take up a primary angioplasty, where the patient comes with an MI, where we need to establish the flow within 24 hours and save the myocardium of our heart, of the patient's heart. So in that scenario, we have taken patients who were COVID positive, but we didn't know the status of the COVID report. We didn't have an HRCT report. It was just risking our lives, including the consultants, and taking the patient on the table, establishing the flow of the vessel, and getting out the patient from that dangerous situation, which is called as an MI, myocardial infarction. Service to patient was our first priority.
At Care Hospitals, we go above and beyond to ensure our employees are cared for so that they can deliver the best results for patients while maintaining their own health and well-being. This balance is something we pride ourselves on.
Evercare Group is one of the largest employer of nurses in the country. We have 2,500 nurses working in our organization. These extraordinary healthcare providers are very vital to the hospitals. They display their care and compassion to our patients every day. We thank our nurses for their commitment, dedication, unwavering care they show to our patients every day.
One of the very first cases which came into India as a positive COVID-19 patient had come to Care Hospital. That case has taught us a lot. We had to create protocols, processes, flow of things, but that was not one person's job. There was a team which was formed comprising of right from housekeeping, paramedical staff, nursing, doctors and all, who had sat together, created protocol, processes, flow of things so to manage COVID in an exemplary way. Protocols were not only created at hospitals, there were a lot of protocols and processes which were created at home also. So I have to thank the families of the healthcare providers who stood by them and helped them and ensured that they come every day to work without fear and fight this COVID-19 pandemic. From bottom of my heart, I would like to thank each one of you who have been part of this Care Hospital journey and helped us in fighting and winning over the COVID-19 pandemic. We will be together, stay together and grow together. In thick and thin times, we'll all stay together. Thank you one and all for all your services provided to us.
We would like to extend our heartfelt appreciation to all our staff during these trying times. Each one of you is a true COVID warrior, working tirelessly to ensure the health and safety of our country. Stay strong and rest assured that we are with you every step of the way. Together we can and we will.